when talking about outcome reporting, program evaluations that are focused on impact, and I think, well, this may just cut across actually anytime you're trying to communicate any kind of research or evaluation findings to non-research audiences. I think there are a couple basic things to keep in mind that some of are obvious, short bullet points, not long research papers. It's a very different audience than a typical academic meeting where you as researchers might typically present your work to your peers. Totally different context. Think about the needs of your audience. What are they there for? What do they want to hear? What kind of information is going to help them make a decision, whether that's a parent or a funder or a policy person. Policy decisions shouldn't get made based on one study of anything. So I think it's our responsibility to sort of put our findings in the context of some other studies on similar topics. It looks like this program had this kind of effect, and the good news is that's really reflects what other folks have found in similar programs. Or, this program seems to not have worked. In this case, we haven't had the findings we expected, but don't be discouraged, because in general we've seen other programs like this have been effective, and we think these are the reasons why this one didn't work. But really contextualizing findings for folks, I think, is really important. We don't do it enough, and thinking about who the best messenger is important. We often assume that the person who conducted the study or the evaluation is the appropriate person to communicate it with different audiences, and it's usually not, except for to their research peers. That's think about who the audience is and who they listen to and who they go to for advice. Often intermediaries are ideally positioned to sort of be the brokers of, bring research knowledge and information to policymakers. They may be perceived as more, as less biased. The researcher themselves who did the study is not necessarily, going to be the most appropriate person to communicate, especially with policymakers and with parents. And young people could be great advocates as well on this. They could be the ones that we send to city council to really talk about their experiences in programs. And in those cases, I wouldn't send the kids in with just like the bullet points from the evaluation. I would have them talk about their experiences in the program and then maybe bring in some of the findings from the evaluation. But I think thinking about who the audience is and who the best messengers are if you're trying to have an influence there is really important.
We try to remember that we live in the USA Today era, and people don't want long, complicated explanations that academics are kind of famous writing. We want material that conveys in the shortest space possible the essence of what's going on. In terms of graphics and in terms of figures that you put in the report and that kind of thing, you've got to design them in a way that people can look at them and they get the message. But to cover yourself with regard to that, a sentence or two about what that actually means in the simple terms. The other thing is, if it's going to be practitioner consumption, then some of the things that we do, again, in academic settings, such as statistical significance and stuff like that, I think the basic terms, correlation, can easily be replaced when this goes up, this goes down, kind of thing. The mean, I often use the average as a way of, the average age as opposed to the mean age. So try to figure out what are the words that in the communication that I have with practitioners every day they're using.
Over the past decade and a half, I've been involved in policy research and evaluation. Oftentimes, community organizations and leaders ask, what is the best way to communicate with legislators the impact that program has, the importance of sustained funding or increased funding, and a way to communicate the efficacy of programs? The unfortunate reality is there is no one best answer, but there are some considerations that can be utilized in trying to construct messages that people can begin to grasp. And When I mean people, I'm talking about legislators whose lives and lived realities are as complex and perhaps more complex than any of us give a consideration. If you can imagine for a moment being an elected official, you have a constituency on youth programmings, on geriatrics, on community and economic development, on sustainable green resources in communities, on transportation. The list goes on and on and on. And so in many respects, what legislators are caught with is the conundrum of how to be an expert on everything and how to respond to the multiple needs of communities, families, and organizations, with the other understanding that there's a limited pool of resources, and how do you invest across all of these domains without disenfranchising or overlooking needs that are politically charged as well as a political responsibility. One approach is to bring to a table multiple people who can talk about the perspective from multi-disciplines. It's not one person who's a talking head on the entire component. So let's say, for example, that we want to do something on the adjudication of youth in adult court. So let's stop taking juveniles and taking them to adult court. Somebody who is a neuroscientist and can talk about brain maturation and brain development and the lack of logical reasoning can probably give a 3-hour spiel on why we need to reconsider the culpability of juveniles because of their inability and the lack of brain development, their inability to understand the consequences of their behaviors, and the lack of brain maturation. The unfortunate reality is, after about 3 minutes, that policy legislative professional is going to be asleep and going to be bored. So we need to chunk that message down to a digestible 2-minute with a written testimony, so that if they want to go back and clarify it, they've got the information right there. It's said explicitly. In addition, you might want a parent who can talk about the consequences and how this has impacted them. A researcher who talks about the loss of social opportunities, or an educator who talks about the educational needs, a psychiatrist who might be able to talk about the mental health. So what we're doing is we're constructing an entire message by deconstructing components with people who carry credibility. It is important as well that a constituent who is impacted by this be there to present and talk from their own emotional perspective, so that the legislator sees one of their faces, one of their constituents, talking to them about the importance of this program.